Okay, welcome back to the Midland Health Podcast, healthcare that makes you proud. Today's guest is Marcy Madrid. Marcy is the Vice President of Community Health for Midland Health. Her current role, Marcy oversees strategic planning, physician practice management, joint venture partnerships, community health outreach, marketing, and public relations. Over her 20 years with Midland Health, Marcy has helped lead the 2012 New Patient Tower fundraising and construction project. She spearheaded a community garden. She's also helped launch the Food is Medicine Health Conference in West Texas. She's collaborated with various community partners and agencies to increase health literacy through a variety of cross city community outreach activities and events. Marcy's among the founding members of both Healthy City Inc. and Pink the Basin, which are both locally grown nonprofits promoting awareness and providing resources to people in the Permian Basin. Before coming to Midland Health, Marcy was a morning show anchor and reporter for the local NBC affiliate, where she was recognized and awarded for her writing and storytelling skills by the Texas Association of Broadcasters. Marcy's a mother to six children and celebrating 19 years of marriage to her husband, Carlos. Welcome to the show, Marcy.
Thank you. Good to be here.
Before we jump into questions with Marcy, I do want to ask everybody to give us a follow on YouTube or Apple or Spotify, wherever you're watching our podcasts. As of today, we have just short of 800 followers on YouTube. We'd really like to get to about 2,500 followers by the end of the year. As I've told you in previous podcasts, we're going to do these shows through the calendar year of 2026 and determine if we've got engagement. Are we getting people that are interested in the material and narratives that we're producing in these podcasts? And if we have a lot of engagement, we want to continue to do them. But one of the ways that we know that is we can watch views, but we can also look at the number of followers. So hit that subscribe button and become a follower of the Midland Health Podcast. Okay, Marcy, tell us a little bit about yourself and your role at Midland Health.
Sure. So you mentioned a lot of my intro already. I've been with Midland Health for going on 20 years now. I started out with no knowledge of healthcare at all. I was focused on marketing and PR. I had a lot of um, uh, skill and expertise in that area, obviously coming from the TV industry. But healthcare began to grow on me over time. I learned more about the system and the structures, and over time got really passionate and interested in the health of our community, improving community health, really doing things that matter and are meaningful to provide value to the community that I lived in and was raising a family in. So now, as my role is today, as you mentioned, it's overseeing the health of the community, strategic planning, marketing and PR, all the things that really impact the things that I'm most passionate about. So I get to show up to work every day and not only get a paycheck, but do things that I love and that I feel are meaningful and really giving back to the community.
Yeah, you're really I hate to say it, like almost an outsider on the executive team. You're pulling against the regular flow of the healthcare business and everything we do. You're the constant. Why do we do it this way? And try to push our team to always think about not sick care but healthcare. How do we make people healthier? And so I know we all value having you on the team, and you have that perspective that's really valuable, not just for the organization but for the whole community. And it's a tough role because it really is still even years later from when you started into this role, and you can read things about healthcare in a different way today than you could 20 years ago. It's still very much a trailblazing path. It's not the standard. It's not what a lot of health systems, certainly if you look at for-profit systems, they invest in this kind of stuff. So
Mhm.
we're glad you're on your team and you kind of keep us thinking about things from a different perspective, from the patient perspective, and what we can do to make people healthy. So
Good. Thank you.
great role. So back in 2014, that's when Midland Health was formed, and things really started to change for our organization. It was a couple of years after the tower opened. One of the things we did that you were at the forefront of helping us develop was an update to our mission, vision, and values. At that time, the vision was created for Midland to be the healthiest community in Texas. This is when, as an organization, we adjusted our focus to include community health and not just acute care, what happens in the hospital. Take me through that shift from your perspective and focus and what it meant to you. How did we land there? Tell us about that journey.
Yeah, that was a really big shift for our organization. I know you were part of that. We had several members of our current and past executive team that talked a lot about this, and we really wanted to provide a meaningful resource to our community. Obviously, the hospital, healthcare system, providing acute care, meeting people and immediate needs was an important resource. But when you think of what we wanted to do beyond that and the bigger role that we wanted to have in our community, we talked a lot about the role of community health. And I think a lot of this got spearheaded with the the issue around behavioral health specifically, because at that time in 2014, over 10 years ago, mental health needs were reaching a boiling point in our community and communities across the country. And mental health wasn't our business. That wasn't something we provided. But what we saw every day in our hospital and our physician clinics, mental health was a contributing factor to so many things that we were dealing with. We couldn't help someone manage their diabetes if they were suicidal, so that was something that was really a light bulb moment, I think, for us at that time, recognizing for us to do a great job at providing the immediate healthcare needs that the community needs from us, we have to recognize the contributing factors of all these other health related issues that may not be our core business. But if we don't step up and make sure that we're providing those resources to our community the best we can, we will never be able to be fully successful in helping that patient at the bedside or helping that patient in the clinic, because it all overlaps and combines. So that's when a lot of our mental health journey began, and the work that is now leading to the opening of our behavioral health hospital this year, recognizing without good quality behavioral health in our community, we will always be falling short in meeting that patient's needs at the bedside or in the clinic. So I think there it just continued to grow of, okay, well, what other health needs are creating gaps as we're trying to meet the immediate health needs of our patients? And that's where the lifestyle medicine approach really came into view in 2014. It actually came to us from a group of physicians, a cardiothoracic surgeon and a GI doc, and someone who specialized in diabetes. They came to us and said, okay, you want to make the community healthier, you want to meet the health needs of our community, you have to recognize that 80% of the healthcare issues that we deal with in the hospital setting are related to chronic diseases. And chronic diseases are largely the result of mostly self-inflicted wounds. I mean, these are things that we can patch up and make better in the immediate circumstance. But if we don't address the root cause of the lifestyle that these patients are dealing with, they'll end up right back in our care. They'll end up right back in our physician office. And we wanted to do better than that. And again, you were part of these conversations. Our whole executive staff talked through this. We really want to do better for our community than patching them up, addressing the immediate need, and sending them on just for them to come back a month later with the same issue. Let's really try to address the whole health of the person, the mental, the social, the emotional, the physical decisions they're making that are leading to the diabetes and the heart disease and the repeat issues. Let's really address the whole person and do a better service to our community in truly making them healthier. Healthier community, healthier workforce that goes along with us, healthier workforce for our partners, our school district, our city, our local oil and gas companies. They can't do a great job in creating a great city if they don't have a healthy workforce. And that's our role, to help them have a healthier workforce. So that's where we began connecting a lot of those dots back in 2014, and it really broadened our vision and our mission to let's do more than just meet the immediate needs. Let's create really a healthier community that benefits all of us at the end of the day.
Yeah, in a previous episode of the podcast, early on, I talked about the continuum of care,
Mhm.
and that for a long time we focused on the hospital. We were Midland Memorial Hospital, and that was really our focus, and that was the anchor of the hospital district and everything that we've done. And over time, and as a result of this journey we went through with our mission, vision, and values, we started to recognize there's really important things that happen outside of our walls that maybe we don't have control over, but it impacts us.
Mhm.
And so how do we get involved in all these things? And mental health is the latest big step that we're making into the continuum of care with the opening of the Permian Basin Behavioral Health Center. But we've got surgery centers, we have a home health agency, we have a partnership with Encompass. So that you're feeding into that earlier episode, that we've got responsibilities outside our walls, even if we don't own that line of the care product. We're responsible for what happens there,
Mhm.
or we certainly can get blowback into the hospital if things aren't managed well outside the hospital. Around this time in 2014, when we were working through this journey on our mission, vision, and values, you had a very personal change. That was the most inspiring thing for me as we talked about this. And I know a lot of people on our team and a lot of people in the community. Can you tell us just a little bit about your personal journey and kind of why this became even more important to you than maybe it would have otherwise?
Sure. Maybe it was divine intervention, maybe it was serendipitous, but at the same time, we were going through this journey of recognizing our role of as a healthcare institution and the importance of community health. And at that time, those physicians brought to us all of this research and data that spanned over years, showing, hey, if people will take more personal ownership and engagement with their own health with the healthcare team, we can help them be healthier at the other side of this, not just keep coming back for routine care, but we can help them have a better quality of life. We can reverse disease. That was unheard of, unspoken of before this moment within our team, within a lot of our physicians. We can actually reverse heart disease. We can reverse diabetes. We can reverse autoimmune disease. And the research over years showed that. So I'm hearing these messages from our local physicians as we're trying to broaden our community health focus. And at the same time, I'm having some numbness pop up a year after I had a C-section from having twin girls. And I'm like, well, this is odd. I had numbness after the C-section. I wonder what it went away. Why did it come back? So I called my OB and I'm like, hey, the numbness from the C-section came back. I don't know why. And they're like, that's not us. Like, you need to call a neurologist. And so they referred me to a neurologist, did a bunch of testing. And to my complete shock, as a otherwise healthy person, strong, mother of lots of kids and very busy, I got diagnosed with multiple sclerosis at the time. And this actually happened in 2015, a year after a lot of our efforts had started in 2014. But at the same time, those physicians were talking to me about personal engagement. So I was really shocked, taken aback. I barely took Advil. The healthiest person you would think you'd know. I was exercising and eating what I thought was a healthy diet. And on the outside, I looked really healthy. And so that really made me pause and try to figure out, what have I done wrong to cause not just, okay, take some medication and you'll feel better disease. Multiple sclerosis is an extreme diagnosis. And most people that get this diagnosis, and I had a family member that had it, it's all downhill from there. I mean, it's the medications you have to take are very harsh, the debilitating effects of it. I mean, you could lose eyesight one day, your leg could stop working one day. You just wake up. They say it's like having a sharpshooter inside of your body shooting at your immune system and your nervous system. So just, you could wake up one day and something doesn't work, and the medication never helps you get better. It manages the symptoms as you progressively get worse, and that's the nature of it. And so it's a really, really awful disease to be someone in my 30s with kids and a career and a very busy lifestyle. So that shocked me. It made me pause. I faced a lot of big life questions and a lot of prayer. My husband and I had to talk through it a lot to figure out, what does this mean for us going forward? Well, at the same time, I had this information from the physicians, and they're largely talking about reversing heart disease and diabetes. It didn't seem like it touched neurological issues as much, because you're thinking about food and lifestyle. Like, how does that affect things that are affecting your brain and your nervous system? I didn't make the immediate connection. But they connected me with some physicians that had done research around autoimmune issues like multiple sclerosis. And there was just as much of a body of research around lifestyle impact for autoimmune diseases like MS. And so I took it back to my husband. We talked about it. It seemed odd and a stretch, but there was research, there was information out there. I had started taking medications already because the fear of, oh my gosh, I may not be able to walk tomorrow. I may be in a wheelchair in a year,
Mhm.
which is what I was being told. I mean, that fear overtakes you and you'll do whatever, take whatever to try to maintain your quality of life. So I had really operated from a place of fear in the beginning and was taking a medication, and I was gradually getting worse. My vision was getting blurry. I had to have people drive me home for work a couple times because I was getting so sick and dizzy and blurry vision. My hair was falling out. I was shaking. I was exhausted by like 3 p.m., like falling asleep on the couch. And my husband's left taking care of our kids. I mean, it got progressively worse after
Pretty
um,
quickly.
it pretty quickly.
Yeah.
Yeah. And so it's like, okay, well, I could try to just eat better. I mean, and better is it's very defined. It's
Yeah.
not just trying to eat healthy, it's cutting out all meat, all dairy, anything that could potentially cause inflammation in my body. I really had to fight with every bite based on the research that was out there. There was no gray area. Um, I'm a pretty black and white person. I could be very clear on what I ate, and I was willing to eat cardboard if it meant I could still braid my daughter's hair without my hands shaking uncontrollably, or I could still walk to their soccer games and not have to be pushed in a wheelchair. I'd do whatever I had to. And so, based on the research and the information, which was not widely known at the time, a lot of people weren't really talking about this, especially for autoimmune issues. But the research was there. There were some longitudinal studies that were done in like the 70s and 80s with Dr. Roy Swank. So there was enough there that my husband and I were able to see and ultimately really pray about what to do, that we felt the confidence of, well, let's try it. What's the worst that can happen by eating fruits and vegetables and beans and legumes and exercising and above all, managing my stress? Stress is kryptonite for autoimmune diseases. So that was probably the hardest thing, was managing stress. So we did it. Um, my physician at the time didn't know what I was doing, had no protocol for not taking medication and doing this lifestyle approach instead. So he referred me to a specialist in Dallas that would also not know much about it, but be willing to let me be a guinea pig and watch me. And within 6 months that it took me to get into that specialist, I had completely changed my diet, lifestyle, again, really worked on my stress, which was a big part of it. And I got a new MRI in April of 2016, and my lesions were shrinking and disappearing. And my MS specialist, my MS specialist in Dallas, said this was remarkable. He had never seen regression on a patient, especially one that wasn't medicated like this. So he became very interested in my case, was very supportive of what I was doing, even though he didn't understand it at the time, and let me continue. So that was 2016
Hmm.
when that kind of journey and confirmation that I was doing the right thing began. And now I'm in a research project with that MS specialist. I still see him every year, but I see him under his research budget and not under not under my healthcare plan. Um, because he's not treating me, he's watching me, he's studying me, and he's actually changed the way that he's communicating and promoting this to his other patients because he has an example of how this works. And I'm doing great. I'm not don't have any debilitations. I still don't take medication. I'm probably healthier now than I was before because I'm managing so many components of my lifestyle with stress and exercise and food. And I feel like I've been thriving ever since, which is not common for MS patients. So,
Yeah.
that's the big personal story I try to tell in a nutshell. But the reason why this was important to my journey at the hospital is because I was like, wow, I could have taken the traditional route and taken the medication and taken all the other medications that are supposed to help with the side effects of the main medication, because MS medications are some of the most expensive on the market. They're close to cancer drugs. They're that harsh. Um, and so I could have just taken that traditional route, but I chose to do something different. That was harder at first,
Hmm.
but created so much value and quality in the long run. And that completely changed my life. It changed my family's life. It changed the mother and the wife that I was able to be to my husband and children. And to me, that was just remarkable. And I was so passionate about getting that information out to as many people as possible because I wanted everyone to have that choice. Like it didn't seem fair that I had this nugget of information that was completely life changing if everyone didn't have that and at least had the ability to make an informed decision at the end of the day. It is hard to make these personal choices, but everyone should have the ability to make that choice and in which way they want to go. So that's where I really became passionate within our health system, within the Healthy City nonprofit that we started with our employees to get this information out as much as possible. So that way everyone could know they have a choice. Yes, we have traditional health care for chronic disease management that we've been doing for years that's available, and here's how that works and here's the results. Or if you want to take a little bit more ownership of your health and get personally engaged, you have a chance to improve your quality of life and actually reverse some of these diseases if you're willing to make short-term hard decisions that mess with your social life
Yeah.
maybe, or how you can eat or where you can eat. It is hard short term, but if you think of the long term impact, I mean, I gave up meat and dairy so I didn't have to walk with crutches or a wheelchair, and I mean that seemed like a small give to have a quality of life that benefited both me and my family and the hospital because I've still been able to work
Yeah.
and do work for our community since then.
Yeah, I think it personalized for certainly for you, but all of your coworkers,
Mhm.
everybody that worked with you and knew you personally and professionally as well. Having a personal story like that, I think really gave everybody a really good picture of what we were doing and why it was meaningful. And, I certainly try to balance being a big brother to the community and telling people this is what you should be doing. I certainly don't want to take that role, but we want to make sure people have the information so that they have the knowledge. And if they want to take these steps, these are options for them. And I think we've done a good job in the 10 years we've been doing this. We have our lifestyle medicine center. We continue to pursue other little paths that can improve this. But I don't know that we would be where we are if you hadn't had that personal story that impacted all of our team and kind of made all of us invest in this kind of a journey for Midland Health and our community. So thanks for sharing that story.
Mm.
I think it's important. A lot of people that are probably interested in this podcast have heard your story before, but maybe there are some people that haven't. And I think when you hear that kind of example, how many people have you heard? I would do anything
Mhm.
if I could just not have pain in my knee. I would
Mhm.
do anything. And like, well, here are some other options maybe that you haven't tried. We don't want to promise that everybody would have the great results that you've had, but it is an option for people out there. There's a lot of literature. We're available through
Mhm.
our lifestyle medicine to help people that are willing to do anything to try to deal with some pain or chronic disease that they have if they want to make that better. So,
I do like to remind people I'm not an anomaly. Like my story seems extreme locally, but there are people like me all over, not only the country, but the world. Since I've gone through this, I've been invited to speak at different conferences in California and Florida. And there is a whole population of people that have made the harder short term choice for the better longer term result and have been just as successful as I have been. So I think it's a formula to follow that can get you great results. It's not something weird or odd about me that just
yeah,
happened to give me great results. It really works for those that are willing to fully commit.
yeah. Disruptive change can
Mm.
start small, but
Mhm.
if we continue to push this information out there, maybe we can see that curve really
Mhm.
bend to a positive thing. So, thanks for sharing your story.
Yeah.
Impacting the overall health of our community extends far beyond the four hospital walls. We've talked about that in the health system. To fully impact our community's health, we can't do it alone. So, tell us a little bit about the partnerships and collaborations that we have at Midland Health that help drive our mission, vision, and values.
Sure. This gets back to some of my earlier comments about whenever we recognize that we wanted to really improve the health of our community and not just try to treat a problem in the hospital because we recognized there was a lot of other contributing problems that led them to the hospital. That's when we realized that we couldn't do it alone because in order to impact the whole patient and the whole patient's health, we needed to touch on the behavioral mental health issues, which is why we have a behavioral health hospital that we'll be partnering with. We had to touch on food insecurity issues and the quality of food that they're getting, which is why we have a great partnership with the West Texas Food Bank right now. We had to
Food pharmacy.
the
Yeah.
food pharmacy program has been great. Gives people access for free to healthy foods that can really help improve their chronic diseases. But you look at everywhere that people go to receive health care in our community on some level. It's not just the hospital, it's Casa de Amigos. It's like I mentioned, the food bank, the soup kitchen. I mean, when you if you're going somewhere for nutrition for your body, that's part of receiving health care. If you don't have any other access to food and you're getting your food from the soup kitchen or a food pantry, then that's how they're receiving health care. And many of these places, they've got clinicians meeting with them and trying to educate them. So we need all those community partners to make this work because these patients may not end up in our care until it's too late. So if we don't reach out into the community and meet them where they are to educate them and support them and make sure they have the resources, the information they need, then we're doing ourselves a disservice
Yeah.
because then we're just waiting till it gets to be too late and it takes even longer to reverse it. So that's why we try to meet them where they are. Our community health needs assessment has been a great insight into where are the greatest needs and barriers that our community is facing to have overall good healthcare, and where can we meet them in the community before they end up within the hospital's four walls or within a physician clinic. And so that's been really insightful to know where we should be focusing our resources, on substance abuse issues and you know, air quality. I mean, there's just a wide range of things that impact overall people's overall health that make our partnerships extend beyond the traditional healthcare setting.
Yeah, a lot of the examples I gave were post-acute care, home
Mhm.
health, and the Encompass Rehab Hospital, and but we want to get upstream to
Mhm.
people, right? We want to get into primary care physician offices and things like the food bank. What can we do before they recognize that they may have a sickness to avoid those kind of things? So those upstream relationships, like with the food bank, is really important as
Mhm.
well. You talked about the community health needs assessment, or the CHINA, that we're required to do one of those every 3 years by the
Mhm.
government. And we hire a company. They come in and look at really what are the health needs in your community, and what should you, as a health system and a leader of the healthcare being provided in the community, what should you be focusing on? So we recently completed a new community health needs assessment just last year. Tell me some of the key things that we want to focus on over the next 3 years, to try to move the needle on healthcare in our community, so that maybe we'll see progress when we do a community health needs assessment again in 2028.
Sure. So the community health needs assessment, as I mentioned, highlights key barriers that the community, I mean, we get feedback from members of the community, from community leaders. What are the key barriers that are keeping people from being healthy? Access to healthcare issues, or healthcare services rather, had come up routinely as a high priority. So we have to figure out, what does that mean? We feel like there's access to our physician offices, obviously, to our hospital, but what does access for our community mean? Does it mean they need easier access? Does it mean they can't get into a primary care doctor soon enough? Does it mean they can't get their prescriptions? Does it mean they don't have the socioeconomic resources to access it? Is it too expensive? Is there a transportation issue? Do they not have resources within their community that's easy for them to get to wherever they live in town? So, what the perception of lack of access to healthcare services is a key area we're going to be looking into more, so that we can meet that need and break down any barriers that may currently exist, for those in our community that feel like they can't access what they need when they need it. The chronic diseases have popped up on our community health needs assessment for the last several years. Heart disease and diabetes are among the two.
Mhm.
We also see cancer. Alzheimer's has been up there, more so recently. Mental health issues
Top of the
is
list for
at the
several
top of the
years.
list, which these are all things we know have been issues and they continue to come up. We know we need to address them. We obviously have a big plan to
Yeah.
address mental health later this year. When it comes to heart disease and diabetes, this is where we get into, okay, we have clinics and treatment options for that, but how can we do a better service to our community and not just help them manage and treat their chronic disease, but actually reverse it so they're not as reliant on our system? And this is where the non traditional healthcare model really comes in that you mentioned in the beginning. Traditional healthcare is a fee for service world. You come to us with your sickness, we do the things to you and charge you for it. To try to think about how for any business to consider, how do we lessen your reliance on us? Pretty that's not a
Sounds
tradition. It
counterintuitive to
sounds
a good business. Yeah.
counterintuitive to try to reduce someone's dependence on your business. But when you think of the kind of business that we're in, um, it's very altruistic and it makes sense, especially as we're trying to be community partners. We're not some big academic medical center funded out of Houston or Dallas trying to provide a service to the community. We all live here. We raise our kids here. This is a community hospital. This was built by the community and the
Yeah.
community funds. And so we would we would not be good stewards of these resources that the community has provided for us if we didn't recognize we want to make you better. We don't want to make you continually reliant on our services, because that means you're not healthy.
Yeah.
That means we're managing sick care, and we want to do more than that for our community because we care. And so really trying to manage those chronic diseases. Again, it's a partnership with a patient. They have to be willing to make some choices and different decisions, but the end result of that could be remarkable. They could improve their quality of life. not have to spend so much time in the doctor's office, not have to spend so much money on routine medications. And that's really what we're trying to do for those particular areas. So those are the areas of focus that have popped up routinely that we're really focusing on this year. How do we reach people where they are with what they need and really try to improve their overall quality of life?
Yeah, really good. I think the community health needs assessment's been a really good tool for us to make sure we get focused. We go through that with our board. They approve an action plan. They just did that in September. All that's available online if somebody's interested.
Mhm.
What is in this report, and what is the action plans that the hospital has put in place? You can go out to our website at midlandhealth.org, access our community health needs assessment, and read it and look at what's happening there. I think it's important for the community to know what we're working on. So we talked about personal engagement, and it's a partnership where we're doing everything we can to try to make our community healthier, but we really need the engagement of the patient to make that happen. The biggest impact that someone can have on their own health is their lifestyle choices, which is about 80% of what we deal with. As you said earlier, about 80% of the patients that we deal with are chronic conditions. It's not the one-offs. There's a big portion of our patients that we see regularly. They go to 3 different doctors every other month, and they're in the hospital once a quarter with some flare up of their diabetes or heart failure, whatever it may be. What are some of the chronic lifestyle diseases, and how do personal choices play a role in those chronic diseases? Cover a couple of those for us that are real common. You
Sure.
kind of hit on those in the China.
Yeah, so we know heart disease and diabetes are two of the ones that we see most common in our community. But a lot of autoimmune diseases, rheumatoid arthritis, lupus, multiple sclerosis, all have large lifestyle components because they're inflammatory, and it's our lifestyle that inflames our body a lot of times. I think the best illustration that I can give of what chronic disease management looks like in traditional healthcare and why we feel like we can do better is if you think of someone that wakes up every morning and before they walk out the door, they kick their shin up against a table. It's just habit. They just kick their shin on the table. So the first day they do it, it's going to hurt a little bit. Second day, maybe it's starting to get a little red. If they do this every day continually before they walk out the door, and maybe even multiple times a day, it's going to get swollen. It's going to get bruised. Maybe they break the skin and they have an open wound. And over time, it may get to where they can hardly walk that well anymore because that leg is deteriorating so much. So they go to the doctor and they're like, Doctor, I can barely walk to my kid's soccer game because it's across the field and my leg's hurting. It hurts when I drive because that's my driving foot. Like I have throbbing pain all day at work. I can't focus. Help me fix this. And the doctor's like, okay, well, we've got things for that. Let's give you some pain medication. Let's give you some anti-inflammatory medication. Let's bandage it up and clean up the wound and give you some padding around it so that way it'll protect that area. And we treat that immediate need. Okay, sounds good. Thanks, doc. I appreciate it. So they go home, they feel a little bit better. They've got some medication on board. They've got a prescription that's going to help manage all these things. And they get up the next morning and they kick the table. And the next day and they kick the table because that's just the habit.
Yeah.
That's how they start every day, and that's just normal to them, and it's just what they're used to. And so you can see how this routine process is they're never going to get better. Maybe with the extra medications, the extra doctor visits, the extra padding around the wounded area will mitigate some of the pain and keep the result of it from happening as fast, but they're still going to end up in the doctor's office again. They're still going to have these mobility issues that are going to impact their quality of life. But what if they went to the doctor and the doctor's like, yeah, I can do all these things, but you could also stop kicking the
Yeah.
table. And that would give you maybe not a short term result like all these medications can do, but over time, you'll get better. Our bodies are built to heal themselves if we give them the ability to do so. That's what's so incredible about the human body. Like it heals itself when you give it the ability to. This damage, I mean, that's what's happened with me. Even MS lesions within my spinal system have reversed and healed when I've given my body the ability to do so. And so that's what chronic disease management in a very traditional setting, diabetes, heart disease, we've made personal choices that have led to these diseases. We do these quick fixes, these medications, these anti inflammatories that mitigate those symptoms short term, but it's never going to make it better.
Yeah.
It's
If you keep
never
kicking the table.
You're just going to keep ticking the table, and think of the table as what you put in your body every day, the stress that you take on, the food that you're consuming, the sedentary lifestyle that you have. If you keep
Tobacco and
doing
alcohol.
that, tobacco, substance abuse, you do that every day, 3 times a day, several times a day sometimes, and you're just kicking that table over and over. So we want physicians that are knowledgeable about not only, yes, these things can help you short term, but there's this option too. If you'd like to try it, that will actually give you better results. It might be hard to break that habit, but your long-term results will be a lot better. We need physicians to give patients that option, which is our role as a healthcare system. Make sure our physicians, our community, our nurses are aware of these options to give to patients. But you can't do it without the patient. The patient has to be like, oh, okay, well, I'm willing to try that. I know it's going to be hard, but I'm the one kicking the table every day.
Sure.
So I'm the one that has to stop kicking the table every day. But cutting that habit off short term will be difficult, but long term, I'll be able to keep going to my kids' soccer games. I'll make it to my grandkids' wedding without being debilitated by injury or sickness or a doctor's visit. I'll be able to travel with my family because I won't have spent all my money on the healthcare system. And that's really what we're trying to shift our focus to provide a better value to the community and really making them healthier and not reliant on our system for chronic disease management the rest of their life. We're here for traffic accidents and major events always. We're always here to meet the immediate needs of our patients. But if you don't have an immediate issue like that and you're just managing a disease, we'd rather you be healthy than rely on us for that because it'll be better for you in the long run.
Yeah. The kick in the table is a great example. And when you come into the hospital or you go visit your physician's office, one of the things I would encourage people is always be honest and tell the truth to your provider. An example that I use a lot is people come into our facility, we give them medication to fix their issue. Hopefully, we've asked deeper questions and maybe we're
Mhm.
trying to resolve the upstream problem that's happening there. But they come back to the hospital a week later, and we go, what happened? What's going on? And they go, I got my medication, but I didn't know it was required to be refrigerated.
Mhm.
And I don't have running electricity at my
Mhm.
house. So I couldn't keep this refrigerated and I couldn't take my medication. So getting to the root cause
Mhm.
can sometimes be a trying to find a needle in a haystack.
Mhm.
It's not obvious to the physician. It's probably not obvious to the patient, or they would probably make some changes. So we ask personal questions about what's happening with this, what's happening in your life, things that may not seem that they're related to the minor illness that you might
Mhm.
have, but we're trying to get to some root cause
Mhm.
things so that we can uh, make sure that we give you the care that you need that you can use that will make you better. And sometimes you got to get really deep to be able to find out what's the best solution for this patient. But the kick in the tables, I think everybody can understand that.
Yeah.
So it's a good example. So when we talk about someone having ownership in their healthcare, tell us um, why is that important, and what is our health system doing to try to push that along?
So again, it's a joint effort. If we really want to make our community healthier, which benefits all of us, it benefits the patient because you have an improved quality of life. But the majority of these patients also show up to work every day. They show up to their kids' lives every day and their families' lives, and so everyone's personal decisions have downstream effects on some population of people around them. Sometimes it's just their immediate family. Sometimes it's the employer that they work for. Sometimes it's the nonprofit that they serve, the church that they go to. I mean, our personal decisions and whether or not we are taking ownership and being the healthiest person that we can be will have some downstream domino effect on the people around us. And that's what we recognize as a health system. At a macro level, we want to provide our community with the best resources, the best information, that we can to make sure that they can make informed decisions. They can have access to everything they need to maintain a healthy lifestyle, not just the resources when they show up in a hospital or a physician clinic to take their blood pressure or give them medication, but access to healthy foods when they're in the community, access to hike and bike trails and ways that they can get fresh air and exercise. We want to make sure as a health system, we're really taking ownership over the overall health of our community and everything that encompasses um, anxiety, depression, the mental health issues, the socioeconomic issues of needing transportation to physician visits or needing refrigeration at home for medication. So we try to take ownership of all components of the health of a person, which makes up the health of our community, because we feel like that's our job. That's the way that we deliver the best service possible because it's delivering a holistic all-in service and not just, well, we'll just focus on this little piece that we can do well and you're on your own for the rest, because we wouldn't be successful. We would have people that are continually broken. And so that's our role in taking ownership, but we need the patients on the other side, and not even just the patients, but the city leaders, the school district leaders, the college leaders, the people that we're actively partnering with now to come to the table and be like, we believe in this. We want our workforce to be healthy. We want our students to be healthy. We want our city workers that run the trash or the trash service or the water service. We need all of them to be healthy to keep showing up to work and providing the resources we need for our community. So let's all join together and create an atmosphere of health in our community as a whole to give our members, our community members, our patients, the best chance possible to maintain a healthy lifestyle and all the resources they need. So then a patient can show up and be like, okay, I'm ready. I'm going to make the right choice. Where do I get food?
Yeah.
Where can I go for a walk? Where can I get information on how to make healthier choices? So that's where the comes in. Partnership comes in. We as community leaders need to step up and take ownership of our roles in each of that. And then we need the community to step up and take ownership in their own lives and their own family lives and be like, yes, I'm going to do this for me and my family and my community as a whole, because my decision has a ripple effect.
And we found that the city and the county and the school district, they're all energized by our discussions with
Mhm.
them about trying to make a change for this. They've got all kinds of reasons that this is important to them. I think the other cool thing with being a large regional healthcare system is a lot of the things we do, we'll try with our employees. We have over 2,500 employees, and if we have four nurses on one unit that call in sick,
Mhm.
get hit with the flu on one morning, that can change the
Mhm.
quality of care that we provide on that unit that day. So it is imperative that we have a healthy workforce that can show up to work every day and deliver the health care that we need them to deliver. So there's a lot of reasons that we're invested in that. We want a healthy workforce. We want that is our mission and vision to lead healthcare for Greater Midland and be the healthiest community in Texas. It's important for us to be able to do the work that we do.
Mhm.
We're a self-insured organization. So when our employees are sick, we pay money out of the hospital's coffers to pay for medications. We don't have Blue Cross insurance. The hospital pays for those costs. It saves the hospital money if we have a healthy workforce. And the same for every
Mhm.
organization. And obviously, we want a well-balanced workforce. We want them to have good work-life balance. It's hard to have that when you're sick all the
Mhm.
time and you feel the stress of not being at work, using vacation time or sick time to be out of the office. Now you can't take time off with your family, or you have limited time off to go and recharge, which we all know is really important. So all those things kind of feed together.
Mhm.
And so we do a lot of the things we do, we try it with our own workforce and go, hey, this has really made a difference. Our workforce has got engaged with this. How do we now take this package, uh, put it in a form that we could go and tell the school district, this is improvements we made with our workforce. We think you should try this. Maybe it needs to be a little different for your workforce than ours, but you should be interested in this. And all of them have expressed support and interest in doing things with us. So we appreciate the partnership we have with all those agencies. As you said earlier, we can't do this alone.
Yeah. To the point of using our own workforce as a trial, when we first started rolling out a lot of this information in 2016, we started with teaching our employees specifically about lifestyle. We took certain specific cohorts of employees that signed up to learn more and took them through a lifestyle medicine program. We completely revamped our cafeteria, the core decision point where people are making decisions, a lot of our employees, but obviously the public too, about what to eat. If you go into our cafeteria today, it is flooded with information about what the healthiest choices are and how food has an impact on your overall health and why it's so important for us to make healthy food choices. And we have many really healthy food choices in our cafeteria. We've got vegan and vegetarian and lots of fruit and vegetable
Mhm.
options and fresh food options to make sure that at that decision point, we are educating them on good decisions and we're giving them resources to then make the right decision. So yeah, that's how we really started with our employees first.
Yep. It's been a good experience, and I think our workforce is engaged in it too, being healthcare workers. Sometimes they can be the most challenging,
Mhm.
but I think they know what our purpose is, and we've made, I think, a lot of differences in the lives of many of our employees by rolling these things out to them. One of the comments I make on any podcast I've been on or any discussion I make, people ask me, "What's the one thing people can do that'll make a difference?" What I always say is develop a relationship with a primary care provider. Even if you're healthy and you're never sick, go see your primary care doctor every year, get a baseline, let them run some labs, so that when things start to get out of whack, even though it may still be within a healthy range, they can start to see, hey, your blood pressure is moving up from where it used to be. I think having a relationship with a primary care provider is the fastest way to make sure you're on top of things as soon as you start to experience life changes, when you start to experience maybe some chronic conditions. So I want to ask you to wrap up today. Uh, Give us a few examples of things that people can do that would kind of drive ownership in their healthcare. What are decisions that they can make today if they're watching this and they go, "I really like this discussion. I want to do something to make a difference in my health." I would say the first thing to do is to get that primary care relationship. What are a few other things that are kind of easy, low hanging fruit that people can start to adopt that'll make a difference in their life?
Sure. Just to piggyback on the primary care provider point just for a minute, this is so important because unless you're embedded and ingrained in the healthcare system, people may not realize that all physicians have a different role. And so if you're seeing a cardiologist, if you're seeing an OB-GYN, if you're seeing what endocrinologist, whatever it may be, when you have specialists, they are focused on a very specific part of your body and your system and problems you may be facing. The role of a primary care doc is to have that broad view, to step back outside of just your heart, just your lungs, just your endocrine system, and really look at your body as a whole and your lifestyle and your decisions and be like, okay, let's look at how all these things may be interacting. And that's the nature of a primary care doc. So people don't realize when they have a cardiologist, they're like, well, I already see a doctor every year. I don't need to go see another doctor. They have different roles and purposes,
Mhm.
and primary care docs are there to put everything together, to look at the picture as a whole and zoom out from that very micro lens that your specialist is looking at and maybe identify other issues that may be coming on. So just some perspective of why that is so important. We have been putting out so many resources. We as the health system since we really started these initiatives a little bit in 2014, but really came out more in 2016. Our website has resources. We have a community resources tab that has information on our CHINA, figure out what the issues are. We've got information on our Lifestyle Medicine Center, which is a great resource. You don't have to be a patient managing a disease to go to the Lifestyle Medicine Center. We do general health education classes. We have diabetes reversal classes if you have diabetes. We've got general health and nutrition classes you can take. I think from a lifestyle perspective, specifically, if you are facing a chronic disease, or maybe you're right there on the cusp, maybe you have a family history of different chronic diseases, educating yourself of the impact that your lifestyle has on that chronic disease, whether you have hit that tipping point or not to where it's clinically diagnosed and you're taking medication, there's a full range of impact that you can have by better educating yourself of food, exercise, substance abuse, and mental and behavioral health, social health. So, Healthy City, the nonprofit that we help stand up, has a website with a wealth of resources, research programs, um, uh, example recipes and information on how to shop in a grocery store to really maximize the money that you're spending on healthy food choices and not just processed foods, how to read nutritional labels so that way you're not just buying a bunch of processed foods that clever marketing has told you is healthy on the front of the box when really you're just getting chemicals. So there's all those resources on what this can look like on the Healthy Cities website, on the Midland Health's website. So just start looking into and researching things and find one place to start. I mean, you may be overwhelmed with all the things that you're doing wrong or all the things you need to fix, and you don't have to change it all at once. Just pick one thing. If you want to focus on food because it's the easiest, maybe twice a week we're cutting out meat and dairy or cutting out processed foods or processed sugars. And then you move to 3 times a week. When our lifestyle medicine center works with patients that are either trying to get off medications or just trying to live healthier, they don't tell them to change everything all at once. They say, okay, let's look at what you're doing, what you're drinking every day, what you're eating every day, how much you're sitting on the couch versus going outside and going for a walk. And let's find what the easiest thing is for you to make a small change today that can give you encouragement to make another change tomorrow and another change the next day. You have to start small. You don't want to get overwhelmed with all the things that need to be done. Find something that you can get a quick win on. Go for a walk every night after a meal. Um, Work on your mental health, whether meditation or prayer or social circles, whatever it may be. Just find some area that you could do better at, and take the first step, and then the second and third and fourth step will be easier and easier.
Yeah. Thanks for sharing that. I think every time I ask nearly everybody a question like this, what are a few things people can do? And the messages are always the same:
Mhm.
diet, exercise, alcohol and tobacco intake, substance abuse, mental well-being, making sure you're recharged all the time. Those are common threads. I think people are going to hear those in every podcast we do, and I think that's a good thing that we continue to repeat that. We'll add some links in the description to the Healthy City website so you can go get some resources and look it through the website and maybe find some ways that you can make some improvements. Also, we'll put a link to our lifestyle medicine center in the description. If you want some help, if you want to come and meet with somebody and talk about ways that you can improve, we'll add a link there. You can get into our lifestyle medicine pretty quick and meet with a professional that can talk to you about lifestyle changes and help kind of manage you through that. So I want to thank Marcy for joining us today. Really appreciate her telling a little bit of her personal story. That's always been inspiring to me to hear that. Hopefully, it was inspiring to you. I want to thank everybody for watching the Midland Health podcast, healthcare that makes you proud today. Remember, hit that subscription button and leave a comment. If we've got several of these planned for the year, but we do have some open spots for topics that we can cover, and we'd really love to hear some feedback from the community. What are you interested in? What would you like to hear us cover? Is there a speaker you want us to bring on? We'll try to get anybody. Give us some feedback so that we can make sure we're providing content that you're interested in. Until next time, thanks a lot for joining us today.